So this is how our group defeated scenario 1. So patient 1 had a suspected broken arm. So what we would do with it had like bones sticking out and stuff. So we would clean the wound and then examine the patient. Okay, so we clean the wound using like alcohol and water from our sink, and then we'd use like cleaning supplies from our medical shelf. And then we would examine the patient using the x-ray machine to evaluate the damage. We would then anesthetize the patient and then set the bone with our medical equipment by placing it in placing the splint. And then we would give the patient morphine, about exactly 5 milligrams every 4 hours, not to exceed 30 milligrams a day. And once swelling subsides, we will fit the patient for a fiberglass cast because it is more effective than the splint. So patient 2 had a large piece of debris in their eyes, and we would keep their head still and remove the debris with tweezers. And then we would bandage with gauze and tape as needed because we weren't sure if it was only in the eye or if it was in the surrounding area as well. We would follow this up with a visual examination from our optometry station, and we would assess the damage to the eye as a whole. So patient 3 had a large cut on their foot, I believe. We would check for signs of infection, and if we did find signs of infection, we would use penicillin to treat and then bandage appropriately. And then we would use that equipment from cabinets and shelves and whatnot. If it was not infected, we would disinfect with alcohol, which we would also get from the cabinets and shelves of equipment, and then we would bandage them. Patient 4 had a burn on their hand, so we would first evaluate the severity of the burn. If it was first or second degree, we would run it under cold water. And if it was third degree or more, we would remove excess dead skin and then run it under cold water, followed by an IV fluid transfer from one of our beds with the IV stations. And we would administer painkiller, and we would choose ibuprofen for this one because morphine seemed a little excessive for a burn, so